Your doctor has recommended taking your respiratory medication with a compressor nebulizer system that allows the medicine to go directly to your lungs, where it is most effective. This video will show you how to use your nebulizer system. The InnoSpire Elegance compressor provides air pressure that works with your nebulizer handset to turn your medication into a fine mist. When using your InnoSpire Elegance, place it on a hard, flat surface, such as a table or counter. Plug the compressor into an appropriate electrical outlet. Make sure the air vents on either side of the compressor are not blocked. The tubing that comes with your nebulizer handset must be connected to both the compressor and the nebulizer handset. You should regularly check the air filter. Pull the filter from the right side of the compressor. If it appears discolored or wet, replace the filter. Turn the compressor on and off using the power switch on the right side. Remember to wash your hands before you set up the nebulizer handset. The SideStream Plus reusable nebulizer uses air from the compressor to turn the medication into a fine mist that you breathe. The SideStream Plus reusable nebulizer should be used regularly to take your medication. You need to replace it after 6 months of regular use. The parts of this high-efficiency reusable nebulizer include a mouthpiece, a light blue top, a baffle, and a medicine cup. Pediatric and adult masks are available separately and can be attached to the nebulizer in place of the mouthpiece. Depending on the model you purchased, there may be additional items such as a backup disposable nebulizer and/or mask. An adult should supervise the setup and operation of this compressor nebulizer system when being used by a child. After connecting the plastic tubing to the compressor, connect the other end of the plastic tubing to the bottom of the medicine cup. Remove the top from the medicine cup. Add the medicine prescribed by your healthcare provider to the medicine cup. Ask for assistance if you're not sure of the amount. Replace the top onto the medicine cup. Be sure the mouthpiece is attached to the medicine cup. Always keep the nebulizer upright to prevent the medicine from spilling out. Begin the aerosol treatment by turning on the compressor. The nebulizer will create a fine mist. Place the mouthpiece in your mouth. Be sure you're in a relaxed, upright position. Remember to breathe through your mouth, not your nose. It's important to get the medicine into your lungs. Take 2 or 3 slow, deep breaths between normal breaths. If you need to stop before the treatment is complete, place the nebulizer in the holder on the Elegance compressor. Turn off the compressor. The average 3 milliliter treatment takes about 8 minutes. You'll hear a sputtering sound when it's time to stop, and the mist will stop coming out. You may need to tap on the side of the cup to be sure you get as much medication as possible. It's okay if there are a few drops of medicine still in the cup. When using a mask, simply attach the mask to the nebulizer outlet port. When you are finished with your treatment, place the nebulizer in the holder on the Elegance compressor. Turn the compressor off. Unplug the power cord. You've also been supplied with a disposable SideStream nebulizer, which has a dark blue cap and a medicine cup that has 3 legs at the bottom. This handset should be put aside and saved as a backup to your reusable light blue nebulizer. Do not use the dark blue one for more than 2 weeks of regular use. Both nebulizers can be used and cleaned in the same way. The SideStream Plus reusable nebulizer must be cleaned between each treatment. Remove the plastic tubing from the medicine cup. Do not wash the tubing. Take the nebulizer apart. Wash all its parts in warm, soapy water. Once a week, you can place the disassembled parts in the top rack of a dishwasher. When hand washing, rinse the parts in clean water, making sure all the soap is rinsed off. Let the parts air dry. Once each week, or as often as your healthcare provider recommends, you should disinfect the nebulizer parts. Do not disinfect the tubing. Boil the parts in water with a few drops of dish soap for 10 minutes. Rinse with clean water and allow to air dry. It's important to replace your nebulizer regularly to ensure maximum performance. Change your nebulizer as recommended per your instructions for use. Now that you've completed watching this instructional video, you should have a better understanding of how to use your compressor nebulizer system. Watch as often as needed to make sure you understand the use of the InnoSpire Elegance.